Welcome to the Vitality Vortex channel. Today we're diving deep into a common but often misunderstood issue: acute low back pain. We'll cover everything you need to know, from understanding the risk factors and common causes of low back pain to exploring effective home treatments and remedies. We'll also discuss the types of medicines that can help manage the pain, things you should avoid preventing worsening your condition, and red flag signs that indicate when it's time to seek medical help. Stay tuned to empower yourself with knowledge and take control of your back health. It's pretty staggering to think that as many as 84% of adults will experience low back pain at some point in their lives. When folks head to their primary care doctor with back pain, over 85% of them won't have a specific diagnosis behind it. It's what we call nonspecific low back pain. For many, these bouts of pain come and go on their own. Bed rest isn't recommended. But for those who can't shake off the pain after about 4 weeks, it moves into the subacute phase, lasting up to 12 weeks. And unfortunately, some folks end up with chronic back pain, which sticks around for more than 12 weeks. Today, we're diving into how to manage and treat that non-specific acute low back pain. But first, let's talk about certain factors that increase the risk of developing a low back pain not related to injury. These include smoking, obesity, older age, female sex, physically strenuous or sedentary work, job-related stress, job dissatisfaction, and mental health issues, such as anxiety or depression. Many different things can cause low back pain. Most of the time, doctors do not know the exact cause. Back pain can happen if you strain a muscle. This is often what has happened when a person throws out their back. This refers to pain that starts suddenly after physical activity, like lifting something heavy or bending over. What causes low back pain? Back pain can arise from a variety of underlying conditions and issues. One common cause is damage to the discs in the spine, which can become bulging or torn due to injury or wear and tear over time. This can lead to discomfort and pain as the damaged discs may press on nearby nerves. Arthritis is another frequent culprit, particularly osteoarthritis and rheumatoid arthritis, which can affect the joints of the spine. These conditions cause inflammation and can result in pain, stiffness, and reduced mobility in the back. Bony growths, known as bone spurs or osteophytes, can also develop on the vertebrae. These growths can crowd nearby nerves or spinal structures, leading to pain and discomfort. Sometimes, a vertebra may become misaligned, commonly referred to as a slipped or herniated disc. This can result in nerve compression and pain. Narrowing of the spinal canal, known as spinal stenosis, can also be a cause of back pain. This condition can put pressure on the spinal cord and nerves, leading to pain, numbness, and weakness. In rare cases, back pain may be caused by a tumor or infection in the spine. While these instances are uncommon, they can result in severe pain and require immediate medical attention. Do I need to get an X-ray for my back pain? Most cases of back pain are temporary and often resolve on their own within a few weeks with proper care and treatment. As a result, most individuals experiencing back pain do not require imaging tests such as X-rays, scans, or MRIs initially. These imaging tests are typically reserved for situations where there is suspicion of a more serious underlying condition, or when the pain is persistent and not improving with conservative treatments. It is important to note that these imaging tests come with their own set of considerations. They expose individuals to radiation, in the case of X-rays and CT scans, and they can be costly. Additionally, findings from these tests may sometimes reveal incidental or minor abnormalities that are unrelated to the individual's back pain, leading to unnecessary worry or further testing. As a medical provider like myself, we typically reserve imaging tests for cases where there are red flags or warning signs, indicating a potential underlying condition that requires further investigation. How is back pain treated? Most people with an episode of low back pain do not have a serious medical problem and can try simple treatments such as the following. Staying active. The best thing you can do is to stay as active as possible. People with low back pain recover faster if they stay active. If your pain is severe, you might need to rest for a day or two. But it's important to get back to walking and moving as soon as possible. While you should avoid heavy lifting in sports while your back hurts, try to keep doing your normal daily activities. Heat. Some people find that it helps to use a heating pad or heated wrap. Using heat therapy can be an effective way to manage and alleviate back pain. Heat helps to increase blood flow to the affected area, which can promote healing and reduce muscle stiffness and tension. While heat therapy can be beneficial for many, it may not be suitable for everyone. Avoid using heat therapy if you have an acute injury with swelling or inflammation. Heat can increase blood flow and exacerbate inflammation. Also, avoid heat application to manage low back pain. If you have a condition that affects your skin's sensitivity or ability to sense temperature, such as diabetes or peripheral neuropathy, this can result to burns. Medicines. First, you can try pain medicines that you can get without a prescription. In many cases, doctors suggest first trying a non-steroidal anti-inflammatory drug, or NSAIDs. This include ibuprofen and naproxen. These might work better than acetaminophen for back pain. You can generally start with 400 milligrams to 600 milligrams of ibuprofen 4 times daily, or naproxen 250 milligrams to 500 milligrams twice daily. You can decrease the dose as pain becomes more tolerable. A second line of therapy with low back pain is a combination of muscle relaxant use. Please be aware that muscle relaxants are sedating and makes you sleepy. These medications are to be used with extreme precaution for fall risk and injury, especially in elderly population. Now let's talk about other treatments of low back pain that does not require taking pain medicines. The choice among these options depends upon patient preference and their cost and accessibility. Spinal manipulation. This is when a chiropractor, physical therapist, or other professional moves or adjusts the joints of your back. If you want to try this, talk to your doctor first. Acupuncture. This is when someone who knows traditional Chinese medicine inserts tiny needles into your body to block pain signals. A massage therapist works on the muscles and soft tissues in your back. If you're experiencing severe low back pain, it's best to avoid deep tissue massages as they could exacerbate the pain and potential injury. Instead, a gentle soft tissue massage is advised to help relax the muscles. While back pain usually goes away within a few weeks, some people do continue to have pain for longer. In this case, additional treatments might include the following. Self-care. This involves being aware of your pain. While you should rest when you need to, it's important to stay active as much as you can. Things like applying heat and doing gentle stretches can help you feel better too. Physical therapy. A physical therapist is an exercise expert who can teach you stretches and movements to help strengthen your muscles. The goal is to relieve pain, but also help you get back to your normal activities. Exercises you can try including walking, swimming, or using an exercise bike. Some people also find that Tai Chi or yoga can help with their back pain. Finding activities you enjoy can help you stay active. Reducing stress. Some people find that it helps to try something called mindfulness-based stress reduction. This involves going to a group program to practice relaxation and meditation. If your back pain is making you feel anxious or depressed, talk to your doctor or nurse. There are other treatments that can help with these problems. Like what we always talk about here at Vitality Vortex, an ounce of prevention is always better than a pound of cure. So, what can I do to keep from getting back pain again? Staying active is crucial for maintaining a healthy back. Incorporating exercises that focus on strengthening and stretching your back muscles can provide significant relief and prevent future issues. Learning proper lifting techniques is also essential. When lifting objects, use your legs rather than your back to reduce strain and potential injury. This technique distributes the weight more evenly and puts less stress on your spine. Additionally, it's important to avoid remaining in one position, whether sitting or standing, for extended periods. Changing positions frequently and taking short breaks to move around can help prevent muscle stiffness and alleviate strain on your back. Incorporating these practices into your daily routine can contribute to better back health and overall well-being. There you have it again, folks. If you can't manage your pain at home, it is time to see me in the urgent care or go see your primary doctor for further evaluation. Seek emergency medical care if your back pain occurs after a trauma, such as a car crash, bad fall, or sports injury. If it causes new bowel or bladder control problems, or if back pain occurs with a fever. Whether you're seeking relief from your annoying and debilitating low back pain symptoms, want to prevent future low back issues, or are simply interested in learning more about this common health issue and home remedies, this video offers valuable insights and tips to help you stay informed and healthy. If you found this information helpful, please like, share, subscribe, and post your comments and experiences below for more informative health content.